Hello, everyone. Welcome to our Emergency Preparedness for Animal Care Providers series. I'm going to give it just another couple minutes for people to join the meeting, and then we'll get started. Okay, people will probably still continue to join, but we'll go ahead and just get started with some initial housekeeping items. So just so everyone knows, this session is being recorded and it will be available on our YouTube. Transcription is enabled. The chat is being monitored, so feel free to drop any comments there, or as well in the Q&A feature. So you can put information either place and we will see it. So this presentation is Current Zoonotic Disease Threats in Southeastern Idaho, and it is being presented by Kristin Langedyke, one of our epidemiologists here at Southeastern Idaho Public Health. So I will transfer it over to Kristin.
Perfect. Thank you, Lori. Let me get my presentation going. It's got a lot of content, so it takes a second to load. Should I try it again? All right, there we go. Looks like it's working. Almost. All right. And you'll have to bear with me. I'm getting over a sinus infection, so my throat will be in and out, but I've got tea. So welcome and thank you for being here today. Also, thank you, BHP, for having me be a part of this webinar series. My name is Kristin, and I'm an epidemiologist for Southeastern Idaho Public Health. My education is in biomedical science, and I've worked in some cadaver labs. I did an internship in a pathology lab, and I was a deputy coroner for Bingham County, where I did some education through the University of North Dakota on death investigations. And I was able to assist in a few autopsies during that stint. So my experience is through the pathology lens, which is great for studying diseases. Like a lot of people, I came to public health through the COVID-19 epidemic. Or pandemic. And first I was a COVID investigator, and then I became an epidemiologist here at Southeastern Idaho Public Health. I'm happy to be here today and hopefully teach you guys something about our current zoonotic threats in our area. And while there are many, we're going to focus on anthrax, bird flu, rabies, and tularemia. So zoonotic diseases are infectious diseases that jump from non-human animals to humans. They can be bacterial, viral, parasitic, or involve unconventional agents like spores. We get these diseases from direct contact with animals or by consuming contaminated food and water or by environmental exposures. They represent a major public health problem locally and around the world due to our close relationship with animals and agriculture as companions and in the natural environment. Zoonotic diseases are also a large percentage of newly identified diseases and existing ones. Prevention methods for each zoonotic pathogen differ. However, several practices are recognized as effective in reducing the risk of spread. And these are safe and appropriate guidelines for animal care in the agricultural sector. Think of like reducing potential for foodborne zoonotic disease outbreaks in like food, meat, eggs, dairy, vegetables. Standards for clean drinking water and waste removal help protect our water sources. Hand washing, of course, is our favorite preventative measure. Educational campaigns to promote hand washing, especially after contact with animals. And lastly, behavioral adjustments can reduce the community spread of zoonotic diseases when they occur. For example, quarantine isolation protocols or teaching kids not to approach dead or wild animals. These are all great ways to prevent zoonosis. For this presentation, we're going to look at our local region, Southeastern Idaho Public Health, or sorry, Southeastern Idaho. And through much of this information is relevant for all of Idaho and other areas in the US and the world. We have the rural agriculture interface with animals. Idahoans are farmers, ranchers, and outdoors people. We also have wildlife reservoirs that harbor infectious diseases. Bats are the easy example. We also have seasonality that affect many of the diseases in our area and their patterns of spread. You can see these graphs below as examples in seasonality in our area. And the H5N1 graph at the bottom shows detections over months starting at 2022 through this week. I know you can't see the months, but the upward trends, they begin at the same time every year around October. They peak in January, December, and then fall. And they're pretty much gone by April. Emergency department visits for tick bites is the graph in the top right. Our current year is in light blue, the light blue teal color. Due to the warm weather and reports around the country, we were and are expecting a bad tick season. A few weeks ago, when we looked at this graph, the trajectory looked pretty scary. But hopefully this drop off that we see continues and is indicative of an early tick season and not necessarily an increase in occurrence. Whether it's early or an increase, this shift in the pattern is likely due to the warm winter we experienced this year. All right, we're going to start with an interesting event that happened this year. Anthrax was discovered in a herd of cattle in Cassia County. Some cattle were ill and a few had died. At least one was taken to Utah for necropsy to determine what was causing the illness and death in the cattle. There was some issue with the hood at the Utah lab. And so the specimen was ended up being sent to Wyoming, and there who first detected anthrax as the culprit. And during the transfer, there was thought to be some exposure. So some individuals in Utah were treated. Once the pathogen was identified, the Department of Agriculture came in and vaccinated the rest of the herd and took care of the animal side of things. South Central Public Health saw to the individuals that were exposed, the family, workers, etc. About 12 people were treated. Public Health District 5 also provided personal protective equipment, or PPE, to the owners of the cattle. We were happy that we got to assist. PhD 5 did not have the medication needed to treat the individuals, so we were happy to help with some of our supply. Public health preparedness, admin, and our epidemiology department communicated quickly with each other to determine how much stock of medication we had and the logistics of delivering it to PhD 5. In the end, about 12 cattle died in a herd of 500, roughly. We didn't hear the final results as the Department of Agriculture took care of the animal side of things, but their quick vaccination efforts, the consensus seems that only the 12 initial cattle were lost. No individuals, the family workers, lab workers, etc., showed signs or symptoms. And this was a multi-state jurisdictional and organization public health effort that had a positive outcome. And we wanted to emphasize the importance of knowing your partners when response is needed. And lastly, we want to say a big thank you to South Central Public Health District for letting us include their story in this presentation. I wanted to ground all this information in reality, and their story was perfect. So we really appreciate them providing us with the details and the permission. All right, so why did this happen? Anthrax is a bacteria called Bacillus anthracis. It's normally found in the western and midwestern United States, often in livestock. Transmission occurs when there is contact with anthrax spores, and spores normally lay dormant in the environment and then become infectious after a period of drought followed by heavy rain. People usually get sick if they come in contact with spores in infected animals or contaminated animal products, though we know anthrax has been used as a bioterrorism agent as well. People can also get spores in a cut or breathe them in or consume them in food and water that's contaminated with the spores. Livestock and wild animals can become infected when they breathe in, eat, or drink spores in contaminated soil, plants, or water. So what happened with the Cassia County cows? The warm, almost non-existent winter created an environment where the spores became active, drought, then sudden moisture. It's also thought that vegetation doesn't grow as high, so the grazing animals will eat closer to the spore-affected soil in these dry environments. For humans, the clinical signs and symptoms of anthrax show up in three main types: cutaneous, respiratory, and gastrointestinal. There are two others, injection anthrax and welder's anthrax, but they don't occur in our region, so I'm not going to cover them today. Cutaneous anthrax happens when anthrax spores get into a cut or scrape on skin when a person handles infected animals or contaminated animal products like wool, hides, or hair. It mostly shows up on the head, neck, forearms, and hands, and it's the most common form of anthrax infection. It's also considered the least deadly. So you get a group of itchy, small blisters or bumps, painless sore, commonly on the face, neck, arms, or hand that has a black center. This is its signature look. When people see this, they think anthrax. The sore appears after the bumps have gone down, and there will be a large amount of swelling around that sore. Inhalation anthrax can occur when a person breathes in anthrax spores. This is the deadliest form of the disease. And you get fever and chills, heavy sweats, chest pain, cough, or shortness of breath, confusion or dizziness, nausea, vomiting, or stomach pains, headache or body aches, and extreme tiredness. And then lastly, gastrointestinal anthrax can happen when a person eats raw or undercooked meat from an infected animal. It has rarely been reported in the United States, but the symptoms look like fever and chills, swelling of the neck or neck glands, sore throat, hoarseness, pain when swallowing. That part's funny to me right now. Nausea and vomiting, especially bloody vomiting, diarrhea, bloody diarrhea, headache, red face, red eyes, stomach pain and swelling, and then fainting. Clinical signs and symptoms for animals. Primarily, it's sudden death is the most common sign, especially for livestock. Other signs are weakness, staggering, fever, difficulty breathing, and bloody diarrhea. The PPE guidance is from the Idaho State Department of Agriculture for veterinarians when dealing with cattle death or suspected anthrax. So this particular list is from that source. And so you'll have like a rubber apron and boots, long sleeves and pants, rubber gloves, and a respirator with a HEPA filter. And when to suspect anthrax, if there are clinical signs and symptoms in humans or animals, the person has animal contact or works in a high-risk occupation. If there is a bioterrorism concern, staying informed on current events is important for considering what infectious agent you might have, including how climate or weather has been. That's another important current event to pay attention to. Dry periods followed by wet weather can activate those dormant spores. Lastly, if you suspect anthrax, do not open the carcass, do not move the carcass, and report to the state veterinarian. Most people will never be exposed to anthrax, though there are some occupations or activities that can put people at higher risk of exposure. These people may be recommended to get the anthrax vaccine. Other prevention methods include PPE, dust control, air filtration, and appropriate livestock management. Again, not opening the carcass, and proper methods of disposal. Treatment, PEP or post-exposure prophylaxis, is given to patients who are exposed to anthrax. Both vaccination and antibiotics are used depending on the type of exposure. Vaccination is recommended as PEP for unvaccinated individuals that may have been exposed to anthrax, like in a bioterrorism event or accidental lab exposure. The PEP vaccination is not recommended in non-aerosol exposure settings, so cutaneous, and so if you get in a cut or etc. And so in those cases, antibiotics suffice. All right, livestock owners who suspect anthrax should contact their veterinarian or the Idaho State Veterinarian's office for reporting. Anthrax is a nationally notifiable reportable disease in the United States and U.S. territories. And of course, it's immediately reportable in our jurisdiction as well. All right, on to bird flu. Diseases caused by avian influenza A viruses usually spread between birds, not people. However, there is one subtype called avian influenza AH5 or H5N1 or bird flu that can cause disease in humans. Bird flu is also relevant today in that it's disrupting a lot of our food supply and causing heavy disease burden. I included a few headlines from last year just to kind of represent that. And there's also an important note for our area. All 13 cattle herd that have been positive for highly pathogenic avian influenza in 2026, so this year in the US, they're all in Idaho. And there are currently 36 other herds quarantined. So we're dealing with a virus this time. H5N1 is enzoic, meaning it is continuously present in at least one species of non-human animal in a particular region. The reservoirs are wild aquatic birds, including gulls, terns, or shorebirds, as well as wild waterfowl like ducks, geese, and swans. Transmission occurs when there is direct contact between infected birds and other animals. Contact with virus-contaminated environments or animal products, or through air by dust droplets if the virus is present in that dust. Human infection can occur when a person touches the virus or byproduct containing the virus, and then they touch their eyes, nose, or mouth. Person-to-person spread is very rare, but it has occurred in other countries. All right, so like most influenzas, bird flu is a respiratory virus. So we see those sort of symptoms: conjunctivitis, mild fever, cough, sore throat, runny nose, body aches, headaches, fatigue. Moderate to severe cases will see high fever or other symptoms listed prior that limit or prevent unusual activity, shortness of breath or difficulty breathing, altered consciousness, and seizures. There can also be complications like pneumonia, respiratory failure, kidney failure, sepsis, and others. Though most cases of bird flu caused by H5N1 virus in the United States have been mild so far, and most they have known exposures to infected animals, so it's not in the general population normally. All right, so birds we see sudden death without clinical signs, lack of energy or appetite, decrease in egg production or soft-shelled misshapen eggs, swelling of the head, comb, islands, wattles, and hocks, purple discoloration of wattles, comb, and legs, nasal discharge, coughing and sneezing, incoordination, and diarrhea. And cattle have decreased milk production, thickened milk, appetite loss, manure inconsistencies, and low-grade fever. People with job or recreational related exposures to birds, dairy, cows, or other avian influenza A virus infected animals, or exposure to contaminated products like raw milk from infected animals are at greater risk of infection. Poultry and dairy workers, animal health workers, responders, food processing workers, public health or lab workers, vets, zoo workers, etc. So yeah, they're all people who are in high exposure settings. And ensuring your staff has proper training on PPE use is important. So the PPE for high exposure settings in those fields I listed prior are the NIOSH approved particulate respirators, food resistant coveralls, safety goggles, boot covers or boots, head cover or hair cover, disposable gloves. There are some differences in medium exposure or milk parlor settings. There's like half aprons they can use instead, but those are relevant for whatever field you're in. And when to suspect bird flu, there is some seasonality to bird flu, like we mentioned earlier. It starts and peaks in the fall, and then continues through winter and ends in early spring. Keeping up to date with surveillance tools like the USDA tracker, which is this graph, and watching current events helps clue in when to suspect bird flu. Knowing risk factors like people's backyard flocks or occupational risks is important, especially with your patients. And then knowing what the signs and symptoms are. So you're looking for something respiratory. So for prevention, there are resources by the USDA to assess how to protect your flock, including self-assessments for like biosecurity. Assessing potential exposures is always a good step in prevention. Keeping germs away by disinfecting clothes, hands, egg trays, crates, vehicles, etc. That helps stop the spread. Limiting visitors to your flock and ensuring they take the same precautions you do. Avoid other wild bird and pests, like don't let migratory waterfowl into your flock or other wild birds mingle. And then obtain your birds from reputable sources. And of course, PPE. For treatment, humans, we can get antivirals if we're sick and supportive care. Cattle, it's supportive care with hydration, NSAIDs, and nutritional support. And then, unfortunately, for chickens and birds, there's no real treatment, just quarantine isolation protocols and sometimes culling. For reporting, producers or owners who suspect an animal disease should contact their veterinarian and to evaluate the animal, the herd, or the flock. And then inform your local health department. Right, rabies is another zoonotic virus. This time it's an RNA virus, Lissa virus. The reservoir in our area for rabies is bats, though other animals like skunks, raccoons, foxes, bobcats, coyotes, and dogs are known sources of rabies. Rabies is a virus, it's secreted in the saliva, so the transmission occurs most often when people and animals are bit by a rabid animal. Transmission is also possible if the saliva virus comes in contact with an open wound or mucous membranes like the eyes, nose, and mouth. Scratches are considered exposures because it's likely the animal's saliva is on the claws. And there are some cases of rabies being transmitted during organ transplants, though it's very uncommon. And then we consider waking up to a bat in your room as an exposure as well. For humans, the clinical signs and symptoms of rabies are flu-like illnesses, discomfort, prickling, or itching at the wound site, anxiety, confusion, agitation, hallucinations, thirsty but panicked by fluids, lots of saliva, and aggressive behavior. Animals, it's similar: fearfulness, aggression, excessive drooling, difficulty swallowing, staggering, paralysis, and seizures. In animals, they can be uncharacteristically affectionate instead of aggressive. This is kind of a more rare symptom, but it happens sometimes. Another stage we can see is paralytic rabies, where the muscles gradually become paralyzed from the wound site out, and then the patient eventually lapses into a coma. In animals, this looks like the limbs and throat, jaw become paralyzed. The lower jaw will drop and become slack, and they'll appear drunk and wobbly. And this is often referred to as dumb rabies. All right, and PPA, it's important to note that ideally no one is handling a rabid animal. Professionals like animal control will wear bite-resistant gloves and other protective clothing, though containing the animal at a distance with catch poles or humane traps is the best practice. PPE is the final physical shield, but it shouldn't be solely relied on. In a medical setting, standard PPE is used, so gloves, gown, face mask, eye protection, etc. And then when to suspect rabies, we kind of covered this earlier in transmission, but it's whenever you've had an animal encounter with a potentially infected animal, bitten, scratched, saliva contact, or if you wake up with a bat in your room. And the same for your animals and pets if there's been an animal encounter or you see signs and symptoms of rabies. So the best prevention for rabies is the rabies vaccine. It is a vaccine-preventable disease. Ensuring your pets are up to date on their rabies vaccine is crucial, and it can save your pet's life during animal encounters. Other prevention methods include staying away from wildlife, seeking medical care if exposed, washing bites or scratches immediately. For humans, PrEP or pre-exposure prophylaxis is recommended based on 5 categories. Individuals who work with rabies virus in labs or handle bats performing necropsies are in the top 2 categories, and they often receive the vaccine. Category 3 is for veterinarians, wildlife biologists, animal control officers, and others that work in similar fields. We also see travelers in this category. And then down to category 5 is the general US population who normally don't receive the rabies vaccine because of the low risk. The table is large, so I didn't include it on the slide, but it's available at the CDC's website if you're interested. The big difference between the categories is how often you get your titers measured. All right, in the case of an exposure, human treatment includes wound care, a dose of human rabies immune globulin, and a 4-dose vaccine series. Normally, the first dose is given at the time of the first medical visit, then again on days 3, 7, and 14 after the first dose. Sometimes there's variation if a patient can't make an appointment or is traveling. And there's a rabies PEP calculator for clinicians on the CDC's website to keep patients in the appropriate window of treatment with their vaccines if there's interruptions. For animals, humane euthanasia is normally the treatment for a high-risk exposure. If declined, a 4 to 6 month quarantine can be done, watching for signs and symptoms. Rabies is immediately reportable to state or local health departments. Report exposures to healthcare providers and your health department. For us, it's Southeastern Idaho Public Health. And so we will help determine your exposure risk and if you need further medical care. Testing for rabies in Idaho requires prior approval from local public health officials. So essentially, the general public can't send in animals for testing. We have to determine if there's an exposure and go from there. All right. Tularemia is a potentially serious illness caused by the bacterium Francisella tularensis. This is one of our vector-borne zoonotic diseases. The reservoirs are rodents, rabbits, hares, and muskrats. Transmission occurs from tick or deer fly bites. Handling infected animals or eating undercooked meats of infected animals. And humans can also acquire tularemia by inhaling dust or aerosols contaminated with the bacteria. There's a wide variety of symptoms that can occur from this pathogen. The mode of transmission determines what type of tularemia is seen. This wide variety can make it hard to diagnose, so obtaining exposure history is important, or ensuring your provider knows that you might have been exposed to, a tick or a rabbit, something like that. All right, I stole this slide from our head epi, Jeff Dorr. You can see that the Rocky Mountain wood tick is the primary culprit in our region, though the western black-legged tick, he sometimes shows up, and these are often called deer ticks. All right, so the clinical signs and symptoms for humans. So again, I think it's how you obtain, like how you came in contact with the bacteria. So it shows up in a lot of different ways. And there's ulcer glandular. This is the most common form of tularemia, and it usually occurs following a tick or deer fly bite or after handling an infected animal. The skin ulcer will appear at the site where the bacteria entered the body, and then the ulcer is accompanied by swelling of regional lymph glands, usually in the armpit or groin. Glandular is similar to ulcerar glandular tularemia, but without the ulcer. It's also generally acquired through the tick bite or handling dead animals. Ocular glandular, this form occurs when the bacteria enters through the eye. This can occur like when a person's butchering an infected animal and touches his or her eye. Symptoms include irritation and inflammation of the eye, and then again, swelling of the lymph glands, normally in front of the ear. Oropharyngeal, this form results from eating or drinking contaminated food or water. Patients with this type of tularemia may have sore throat, mouth ulcers, tonsillitis, and swelling of lymph glands in the neck. Pneumonic, this is the most serious form of tularemia. Symptoms include cough, chest pain, and difficulty breathing. This form results from breathing in the dust or aerosols containing the organism. And it can occur if the other forms are left untreated and the bacteria spreads through the bloodstream to the lungs. And then there's typhoidal. This form is characterized by any combination of the general symptoms without localizing symptoms or of the other syndromes. All right, I left this slide intentionally busy. Tularemia is described as having many faces. I'm not obviously going to read all these, but we saw that with humans, the route of infection determined what symptoms might appear. With animals, it appears differently also in each species. The important thing is to know a few of the signatures, like the high fever, the swollen lymph nodes, along with difficulty breathing. Tularemia shows the importance of knowing seasonality and exposure information, since it's so hard to diagnose with its wide variety of symptoms. So you want to ask, is it tick season? Does my patient consume game meat? Also knowing your clients. If you're a veterinarian that helps sheep herders, you might consider tularemia more often. So it's important to be aware of those kind of situations. Standard PPE is used when dealing with tularemia, and handling dead animals with gloves is important. I suspect tularemia when it's tick season. There's a person or a pet that's been bit by ticks or fleas, if there's an open sore, swollen lymph, or high fever. And it's tick season's normally March through June for us. Sometimes July, but once it gets too hot, they kind of hibernate. All right, prevention methods include using EPA-registered insect repellents, wearing long pants, long sleeves, long socks to keep ticks and deer flies off your skin, especially if you're hiking or doing outdoor activities. Remove attached ticks promptly if you do get any. Don't drink untreated surface water. Using masks during mowing and other landscaping activities may reduce your risk in inhaling the bacteria. Picking up carcasses before you mow is important so that you don't aerosolize the bacteria. Using gloves when handling animals, especially rabbits, muskrats, prairie dogs, and other rodents. And lastly, cook game meat thoroughly before eating. Treatment for both humans and animals is antibiotics. You can see which one's there. And tularemia is immediately reportable to the state or local health departments. In the animal industry, it's immediately reportable to the Idaho State Department of Agriculture. All right, here are some other zoonotic diseases to consider. This is not a full list, but for rodent and wildlife associated, hantavirus obviously is one that we're all thinking of right now. Plague, we see that in Idaho actually more often than people think. Waterborne environmental exposures, we're looking at like crypto and giardia. Livestock or agriculture related, we got Q fever, salmonella, campi, brucellosis. And then vector-borne, of course, West Nile limes and Rocky Mountain spotted fever. So mass care, in coordination with public health preparedness, we wanted to look at zoonosis and mass care events. What would we need to consider? How do we prevent them? What variables would increase the likelihood of these diseases occurring during a mass care event? So pests like rodents is an obvious one. Clean drinking water, people's pets and other animals. Can we wash our hands to prepare food? Questions like that. So non-pharmaceutical interventions are great preventatives against infectious disease. Ensuring there are hand washing stations, having a separate area for animals, the Pets Evacuation and Transportation Standards Act of 2006, Pets Act, requires state and local emergency preparedness operational plans to address the needs of people with household pets. Though the legal obligations for this only apply when it's a federally declared disaster. Regardless, it's something we need to plan for, and I personally would want my pets to come. So if the shelter operators allow animals, there should be a separate area for them. Often they should remain in carriers. Routine cleaning and waste removal so animal waste doesn't build up is important. Masks and PPE are the often go-tos for disease prevention. Rodent and pest control is important. Quarantine and isolation areas and protocols need to be in place for anyone who does become ill to prevent the spread to the larger population residing in the shelter. And from there, case management of sick individuals becomes important. This is where epidemiologists come in. We would do the intake of individuals and identify their exposure history, monitor them, do contact tracing to identify others that may be exposed. Ideally, we'd already have an area for individuals to recover without exposing others. And all this while ensuring we're HIPAA compliant, protecting individuals' information while protecting the community. And then environmental staff or individuals assigned to running a mass shelter, and maybe even the shelter operator, would want to ensure certain things are available to the best of our abilities. So food safety is a major one for preventing disease, making sure hand washing stations are available, especially for anyone preparing food. Having potable water sources. If you think about flooding, it can contaminate our water sources, and so that's something we need to always have on mind. Waste removal, air filtration, and lastly, temperature control is important, especially for vulnerable populations. So a quick recap of everything. Be aware of clinical signs and symptoms. Pay attention to seasonality and current events. They can help you clue you into what diagnosis you're looking at. Know what to ask if you suspect a zoonotic disease. Have heightened awareness during mass care situations and seasonal influxes. And then work with your partners, vets, doctors, public health, anyone really, to ensure you have the resources you need before disease or disaster happens, like PPE, educational tools, etc. All right, and with that, we can take questions, and I'll just skip also forward to here's some sources, and if there's any of the dashboards you would like, let us know and we can get them sent to you. And thank you for attending. If you can fill out this survey, it would really help us out to ensure that we provide useful presentations in the future. But otherwise, yeah, questions are good to go.
Feel free to drop those questions in the chat in the Q&A box, or you can come off mute to ask if you would like as well. Okay, yes, we've got a question about the link to the survey being put in the chat. Let me do that real quick. And Kristen, it looks like we've got a question in the chat. Any information or comments on the incidence of vector-borne rickettsial diseases in southeastern Idaho, such as Ehrlichia?
Yeah, so currently I'm not very versed in those incidences, but we can get you information about that if you're really interested in it. So I think Lori should have your email, and so we'll provide you with some information on that. Perfect. Yeah, we'll make sure you get some information.
Yep, we will get that for you. Do we have any other questions?
Also, thank you everyone for being patient with my voice. I know sinus infection wasn't ideal for this.
Yes, we appreciate that all the more, you being willing to be here and present, especially with your voice. I know this was a lot of talking. You covered a lot of information. It was fantastic. I especially like that you included those local examples. I would just like to kind of add on to that with the anthrax that was in District 5. We were really glad that we were able to support by providing medication from our cache of medications, just also to make individuals aware for some of these zoonotic diseases. Public health preparedness is able to provide either medications or personal protective equipment, depending on the situation. So I will take back the presentation so I can put up our preparedness information as well. Okay. So also just to mention, we do have one more session coming up. We are going to have Kristin back again next week to talk about zoonotic disease threats that are currently being monitored for pandemic potential so that we can kind of stay ahead of that. So that will be a great presentation. I don't know why okay. This is supposed to be the QR code for the feedback survey again. It is in the chat. This other QR code is to register for the other session if you are not already registered. And then we've got Kristin's contact information as well as information for preparedness down there. So we thank you very much for being here. This presentation was recorded and it will be on our YouTube. It might take us a couple weeks to get it reviewed and posted. The entire series will be on there. The first session, the Red Cross's presentation on mass care shelter procedures, has been posted. I think it just went out today, but it is available on our YouTube channel. And yeah, thank you again, and we will hope to see you next week. I will stay on for just another moment so that people can make sure that they get that registration link and and I can drop that in the chat as well, actually. Okay, there's that registration link.